Hello. Wanted to kick off our weekly Facebook Live. As you can see, I'm by myself today. I'm Elizabeth Hallgren with Mission Direct Primary Care. We're a membership-based primary care practice here in Omaha, Nebraska. I am on my own because Dr. Hallgren is tied up with patient care today, which is the number one most important thing that he does. So today I'm going to do the prize drawing from the Millard Business Expo. We attended that yesterday, and also, we're going to talk a little bit about prescription drug prices. As you can see, I'm not in the clinic. I'm not at the Mission Direct Primary Care World headquarters like we are week in and week out. I'm working from home because of this snow day. Did not want to get out and about in the mess today. So working from home, which is a great perk of owning your own business. So yesterday, we went to the Millard Business Association's Expo, hosted by Excel Roofing in their community center, and it was a great event and opportunity for us to talk to all kinds of folks who are involved in the local business community, and talk to them about their experiences with either as business owners trying to offer a health benefit that's meaningful to their employees to help with that recruitment and retention, or the challenges that they're facing trying to get a health benefit together to offer to their employees. And had some great talks about how direct primary care membership with us can be a really great addition to their offering to their employees, because it's a benefit from day one that your employees see in their wallet, right? I mean, from day one, they can go see their doctor, their Mission Direct Primary Care doctor, either Dr. Hallgren or Angie Ling, and it doesn't cost them anything. And they are getting that very personal care from day one. So if you want to talk about that with me, if you're an employer or work for a company that's looking for some solutions, please reach out to me, and I'm happy to have those conversations. The other conversation that I had frequently was that came up yesterday, which doesn't always come up, is about prescription drug cost and how can we best navigate that minefield, because it is out of control right now, and people are being exposed to really exorbitant pricing, personally being asked to pay that were never supposed to be exposed to consumers. So we have a couple of tactics that we like to share with people so that they can be empowered to kind of take control and be as informed as they can around how to access their prescription drugs that keep them healthy at the most cost-effective rate. One tool that we ask and constantly preach about and ask everybody to download is the GoodRx tool. It's a shopping app. You've probably heard of it. They're doing a lot of advertising and promotion. It's just a real simple shopping tool that you download on your phone or access on your computer. It's free to use. And you put in what your prescription is, what your, the amount you're taking, the milligram amounts, and it will find the best price for you in your local market. And so it's a really great tool, and it's huge, the price differences. Dr. Hallgren was presenting at the Rotary Club, the Millard Rotary Club last Monday, and speaking about ways to save money on your healthcare. And one of them and spoke about GoodRx, and one of the audience members put in his medicine that he's taking for his prostate treatments. And on the high end, it was, I think, over $130, and on the low end, it was under $20. And that was just using the GoodRx tool and going to get it at, say, Baker's versus going to get it at the Walgreens. So it's a very powerful shopping tool. So always start there. That's the number one place to start. The second place to start, the second place to go if you have a drug where you're not seeing much variation in the price on GoodRx, is to go to the drug manufacturer itself. So, and look for what kind of consumer programs they have. Many drug manufacturers will have programs and coupons that are available for people that they consider to have an underinsured prescription drug benefits. And you can get a coupon to get a discount from them on the price of your drug that you're required to pay. I've seen this, for example, with the NuvaRing, which is a birth control option, a prescription birth control, that they have a $50, I think it was $50, basically coupon that you can use to reduce the cost of that, because there's not much price variation on the market if you have an insurance plan that's not covering it. So if you're on an expensive biologic or just an expensive new drug that's just come to the market, always check with the manufacturer to see what kind of programming they have to reduce their drug cost. And then the third way is to ask your doctor and see if there's another option that you can be put on, and that will be a lower priced medicine. And it's always appropriate to engage them in that conversation. If you are seeing a typical fee-for-service doctor, they might not know about drug care costs, but it's always legitimate for you to ask them and ask for ask to research more cost-effective prescriptions. For example, I was just switched to a hormone replacement therapy that's new to the market that is basically just takes 2 drugs and combines it into one. And it is more expensive than my previous therapy, but talking it through with my doctor, I have the option to go to taking 2 separate pills instead of the one, and then that is a lot less expensive. And so coming up with an alternative solution, and trying it out and seeing how it works for you. So those are kind of my 3 top tips for being a good consumer around your prescription drugs. Is first, GoodRx. Second, go to the manufacturer's website. Third, engage your doctor and see what you can do about that. So I'm just going to be short and sweet today. We have all of the business cards from yesterday from the Millard Business Expo in here. And what we are giving away is 2 things. First is a wellness visit with Dr. Holgren. If you need for our winner, whatever they choose to use it for. And then this book, which is fantastic. And I think we should all read it. It's called The Price We Pay. It's by Marty McCarty. And it is basically a breakdown of what is driving the crazy healthcare cost. And if you're a business leader or responsible for sourcing healthcare for your business, you really need to read this, because it really talks about the perverse incentives that are in the current insurance markets, how you can be a better shopper for your business, and just kind of what we need to know. And it sounds nerdy because it is, kind of an economics-driven book, but it is a really interesting read. So we're giving away a copy of this as well. And I'm going to draw. I don't have anybody to help me, so let's see. It's our friends at White Castle Roofing, Josh. And so I will be contacting you. And congratulations, you won the doctor's visit and the book. So thank you so much, and thank you to the Millard Business Association's Expo yesterday. It was great to get to know your community and just a room full of great people. I will drop the link in the comments to GoodRx and the title of the book, just so everybody has it, because I think both of those are really great resources. And I fancy myself to be a healthcare cost consumer advocate, and just want to arm you with the information you need to know to spend your healthcare dollars better. If you have any questions about our direct primary care memberships and what they include and how they can give you a really predictable and affordable way to have a great relationship with your doctor that will save you money over the long term, particularly if you have a high deductible, give us a call, and we'd be happy to talk to that with you. Thank you. Have a great Thursday.